what you think anxiety signifies, how it's related to exploratory behavior, which I think you described as something approximating courageous approach, although you were talking about mice in that particular paper, and what you're thinking about with regards to the neural basis of these different behavioral responses, behavioral and emotional responses.
Sure, I'd be happy to. And I should mention that these days my laboratory mainly focuses on humans. We still do some mouse work, but we, in partnership with people in psychiatry, we're doing essentially equivalent experiments in humans, so I'd be happy to elaborate there. You know, many people perhaps, but not everyone, have heard of the autonomic nervous system, which simply means automatic. It's a bit of a misnomer because without going too much into the history of that, if you look back to the origins of medicine in the time of Galen and so forth, when they were first dissecting cadavers and whatnot, there was this idea of a nervous system, or a portion of the nervous system eventually came to be, that could control so-called vegetative functions, meaning the rate of digestion and the really what neuroscientists typically think of as boring stuff. But it's anything but boring. It's the stuff that keeps you from urinating while you're asleep, unless you're a very young child, right? And it's the stuff that keeps your digestion going as you command your attention to other things. The autonomic nervous...
It's all the things that are too complex for us to think through.
That's right. And they are, as you point out, immensely complex. And nowadays with all this interest in the gut microbiome and things of that sort, I mean, these are tremendously complicated operations that are happening generally below our conscious awareness, and that are indeed vegetative. They can be controlled by emotion. We were all familiar with the idea that when we are emotionally distraught, that our digestion can be different, or etc. But typically, we can't control, for instance, in a conscious way, the rate of our digestion or the speed of our heartbeat in any kind of direct way. We can have a particular pattern of thought to control those, but in general, those functions were thought to be vegetative and outside of our conscious control. And the name autonomic nervous system sort of swallowed and overtook the vegetative part, so it includes that, but also three main aspects of body to brain signaling. And those three aspects are heart rate, could be quickening or slowing of heart rate. We are and we can be very aware of that, some of us more than others. Gut, and especially the chemical composition and the extent to which our gut is empty or full. So heart, stomach, and then rate of breathing and sort of depth of breathing, meaning how much air we have available to us. And I think the three main ways to think about the way that the brain and body communicate is that it's either going to be mechanical or chemical. Let's use the gut as an example. Your stomach can feel acidic, or it can feel nice and warm and fuzzy, whatever that is in a chemical sense. Your heart rate can feel like it's going at a rate that's appropriate for your circumstances. If you're running, it could be quick. And if you're sitting in a chair quietly at the doctor's office waiting to be called back there, and all of a sudden your heart starts racing, then you would think, well, that's appropriate for that situation, but it's not uncomfortable, right? It's out of sync with what you are doing, which is sitting. So there's mechanical information, and then there's chemical information. And with respect to your lungs, you can feel like you're out of air or you have plenty of air. You can feel like your breathing is labored or it's easy, or in the chemical sense that the air that you're breathing, your lungs are burning, or it feels easy to breathe. So basically there's chemical and mechanical signaling from the body to the brain, and the brain interprets all of that, and we put all of that under the umbrella of the so-called autonomic nervous system. And the autonomic nervous system can really be best thought of along a continuum. And here I'll avoid complicated nomenclature, but I'll throw it out there for the aficionados. Some people have probably heard of the parasympathetic and the sympathetic. That naming is a little bit misleading. Again, what we can really think about the autonomic nervous system as is a continuum, or more like a seesaw, of at one end is alertness, and at the other end is calmness. Right? That is translated to the so-called sympathetic and parasympathetic nervous system, but I'll call it the alertness and calmness system just for sake of simplicity. So it's sort of like a seesaw, and it has different neural circuits, and basically whether or not you feel very alert or panicked, or alert but calm, or a little bit of anxiety, that's going to depend on the balance between this alertness system and the calmness system. If you're having a full-blown panic attack, then the alertness system is, it's as if the seesaw is tilted all that way. If you're deeply asleep, well, then the calmness system is really tilted down. You could say that's a portion of the seesaw. This is all kind of obvious, and dates back, 100 years or so, which isn't that long in the history of science, but we've known this sort of thing for a while. Okay, What's interesting and I think more relevant nowadays is to think about one's own interpretation of those signals and how that relates to anxiety and, as you pointed out, exploration, and then to think about where the nodes of control are. In this seesaw model that I'm putting forward, the seesaw has to include what I would call a hinge, a location in the middle in which you can voluntarily adjust the seesaw to either be more tilted toward alert or more tilted toward asleep. And for many people, they find that their overall level of autonomic arousal is either inappropriate or inadequate for the demands of their life. Inappropriate meaning their heart is racing, they feel more jittery, more as if movement would be the default and worry would be the default and anticipation is the default than is appropriate for their circumstances. Waking up in the morning and feeling stressed, for instance, immediately without any immediate cause or maybe stress about real life events. For other people, they feel more exhausted than they would like. They're having a hard time leaning into the pressures of daily life. Both of those, even though they have sort of polarized phenotypes, they look very different. In one case, over energized, and in one case, under energized. Both originate within the autonomic nervous system. And we can reliably say from work done in animals and humans that that is not the consequence of the alertness system or the calmness system being disrupted, but rather that hinge in the middle is dysregulated. And we now know what that hinge is. And this is based on work done by colleagues of mine at Stanford, in particular a guy named David Spiegel, who's our associate chair of psychiatry. He's done a lot of work, and it's actually his father did a lot of work in the application of clinical hypnosis, not stage hypnosis, but clinical hypnosis for the treatment of various things. But his work and some work in our laboratory now has shown that there's an area of the brain that you are familiar with, Dr. Peterson, which is the prefrontal cortex, and in particular, the left dorsolateral prefrontal cortex, if you really want to get down in the weeds about it, that has direct communication with two brain areas that are absolutely critical for this issue of whether or not you feel right for your circumstances, whether or not you translate that into a curiosity and exploration, or whether or not you translate it into this thing that we call anxiety. And those two areas are called the anterior cingulate cortex. Again, I apologize for all the names, but the anterior cingulate cortex and the insula. And I think if I were to make a prediction about what the buzzword is going to be in popular neuroscience in the next 5 years, it's not the amygdala, it's not the prefrontal cortex, it's the insula. The insula has a couple of different regions, but one of its primary regions, the front end, the anterior insula, is responsible for interpreting all those bodily signals. It essentially is a funnel for all those signals about breath rate, heart rate, conditions of the gut, whether or not your body feels ready to move or exhausted, et cetera. And that all funnels into the insula. And then also coming into the insula is information from classical areas like the amygdala, which are involved in threat detection and fear, and also emotion and memory. So the insula is really this incredible hub of information about somatic signals, about bodily signals. And then the prefrontal cortex, the dorsolateral prefrontal cortex in particular, is in communication with the insula and literally makes a...
So let me ask you about that. So does that mean that, the body in some sense is reporting to conscious awareness? Now it reports unconsciously in all sorts of ways too. So it might report to the hypothalamus, which is a very low level brain control area, by the way, for those of you who are listening. It might report to the hypothalamus primarily unconsciously. But do you think it's the insula that's reporting on the nature of bodily states to the prefrontal cortex in a manner that allows us to be consciously aware of our body states?
That's exactly.
Is that part of that integration system?
That's exactly right. You're exactly right. The insula sits as a different sort of station in that it's reporting to the conscious areas of the brain, to the prefrontal cortex.
Right. So we can take our own physiological state into account then when we're envisioning plans, because part of what the dorsolateral prefrontal cortex does is allow us to envision different possible futures. And those are plans. And you're not going to make a plan to run 2 or 3 blocks to get to the corner store if you're so exhausted you can't get out of bed. And you need a reporting mechanism that tells you what physical state you're in so that you can predicate your plans on that. You think the insula, at least in part, is responsible for formulating those representations or for reporting those representations.
That is exactly right. In fact, the animal data and the human data, both lesion data and reversible inactivation data, support that in humans. So you have that exactly right. And as you mentioned, the prefrontal cortex it gets sort of thrown out there for everything. I think, nowadays people have probably heard of the prefrontal cortex, and people hear about executive function, which of course is true. But if we were to really dial back and say, what is the prefrontal cortex in the position to do? It's a flexible rule-setting structure. How do we know that? I'm sure you are probably more familiar than I am with the classic Stroop task. You give somebody a bunch of cards with different words on them, and those words are written in different colors, and you tell the person, okay, just read the words to me. Ignore the color that they're written in, just read them. And so they're saying they're cat, dog, shelf, book, professor, student, etc. Then you quickly change the rules and you say, you know what, just tell me the color that the words are written in, but ignore what the words say. And people will do that, but there's a portion of time in which they slow down a bit. It's actually hard because you've done a rule switch. Much of life, as you know, and again, this is more your domain than mine, is about applying different rules in different contexts. Now, what we know is that the insula and the prefrontal cortex are both intimately involved in this conversation that establishes which rules are appropriate for a given situation. So, for instance, if somebody were to say something that quote unquote triggers me, okay, I'll use myself as the example, right? Maybe someone will tweet something and I'll think, and I immediately want to respond in a way that I know I can kind of flip them on their back immediately. But then I think, maybe I want to refrain from that for any number of different rules or reasons, right? Well, then I'm starting to apply different rules. I'm starting to think about the context that's outside of the autonomic response. Because in a strict, very animalistic way, in other words, in the absence of an insula and a prefrontal cortex conversation, really the only thing an animal or human needs to do is just respond to their arousal it's either, you can either retreat, you can stay put, or you can fight.